Jennifer Conant here doing a physical monitor video. Before I come in the patient's room, I would scan the room to make sure there were nothing out of the ordinary. Wash my hands, introduce myself. Hi, my name is JJ. I'm your nurse for the day. I'm going to be doing a physical monitor on you. Can I have your name and date of birth?
John Conant, 8/1968.
Okay, I'm just going to check that. John Conant, 8/1968. Okay, great. I would also provide privacy before this. This monitor is going to take about 15 minutes. Why are you here right now?
I just thought I needed a checkup. It had been a long time.
Okay, and what year is it?
2020.
Great, and where are you right now?
MCHB.
Wonderful. So patient is alert and oriented, +4. And so next we will raise the bed, and then I ask my patient if he's having any pain. Do you have any pain?
No pain.
No?
No symptoms or anything.
Great. No pain, or I'd ask if it was on a scale of 0 to 10, but no pain.
I'd go with 0.
0 is great. Okay. So I'd be taking his vital signs, and we already took the vital signs. Your blood pressure was 120/70. Let's see, your pulse was 70. Your respirations were 18. Your oxygen was 97, and your temperature was 98.6. And his temperature I took under the tongue, way back in the throat. If he had eaten or drank anything in the past 20 minutes, I would have taken it under his axillary, but that was not the case. So we'll start this monitor from your head. I'm going to check your head. Yes, your head. We're going to check for any bumps, bruises, any, I don't know, lice, anything abnormal. Great. A little bit bald right there. All right, so then we're going to check the face. We're going to check for symmetry of the eyes and nose. Everything looks symmetrical. Also going to check his nares, if he breathes out of both nostrils. Wonderful. Okay, I got my light. Can you look up at the ceiling? I'm going to check here. I'm checking for his sclera to see the color of the whites of his eyes. If it's yellow, it would have jaundice. Let's see. The pupils are equal, reactive to light and accommodation. I'm just going to pull your eyes down and check. Everything's nice, light pink. Great. While I have the light, I'm going to check his ears for any sores or whatnot. Or any buildup of earwax too. And now I'm going to check your mouth. Great. Mucosa is pink and moist. Tongue is pink and moist. Dentition, very good. No sores. Yep. Anything else in there? I can't remember. Can't remember. All right. Oh, guess what? Swallow. That was neck. That was part of your neck. So now let's check his swallowing, which is fine. I'm also checking his neck for distensions. I'm going to check his carotid pulses, excuse me. You do one at a time, never take them at the same time. His carotid pulse is +2. And now we're going to go to the chest and auscultate your heart sounds. I'll start off with the apical pulse for 1 full minute. And after that, I would check the radial pulse to do a pulse deficit. You minus the radial from the apical and get a pulse deficit. And it's 0, the same. And now, we'll start off with your aortic, second intercostal on the right. Take a deep breath. And then your pulmonic, second intercostal on the left. Herbs, third intercostal on the left. Tricuspid, fourth intercostal on the left. And mitral, fifth intercostal on the left. All sounds are clear and normal. If the sounds were abnormal, you would use the bell other stethoscope to listen further. Alright, there I'm going to listen to the lungs. Also, when he's breathing, I check for any nasal flaring. Okay. This is right upper lung. Deep breath. You can cough. Okay, good. Left upper lung. Right middle lung. You don't have to cough anymore. Right lower lung. And then left lower lung. Great, nice and clear. Now check for any orthopnea or retractions. I'm going to check to listen to the lungs in the back. Right upper lung, left lower lung, left upper lung, left lower lung. I think I said those right. I'm kind of tired. And then also while I'm listening to the lung sounds in the back, I would look at the back for any moles or any skin breakdown, pressure sores, anything like that. Great. So other than that, I think I'm going to ask you to. Oh no, that's right. I wanted to. I'm going to check the turgor in your arms. No tenting, so he's very hydrated. Wonderful. Check your cap. Yes, you have big muscles. And then check your cap refill. Less than 3. Wonderful. Can you do your range of motion? Abduct. Huh?
Ow.
Oh, lift your arms. Abduct and then adduct. Great. +5 range of motion. Okay. I guess I'm going to have you lay back and we're going to listen to the abdominal. Let me think for a minute. I'm kind of going fast, but let's see. Yep, I think that's it. I think I'm going to.
Moving down the body.
Yeah, I mean, I could palpate his brachial. That's one thing I possibly forgot. And palpate the radial. I also could check the strength, grip strength. Oh, yeah. Push. Okay, so I'm going to listen to the sounds of your abdomen, all 4 quadrants. Right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. And I hear normal bowel sounds. If I didn't hear normal bowel sounds, I want to listen to all 4 quadrants for 5 minutes apiece to make sure you hear bowel sounds. I'm also going to palpate and check for any distension or any bulges. Do you have any pain or anything?
No, man.
No. So how is your bowel pattern?
A couple times a day.
Good. Any color or bad, anything abnormal?
No, about always the same.
And you have a good healthy diet?
Yes.
Yeah. Also, color of your skin is good. Same with his arms. The color of the skin is really good. There's no, let's see. So we're going down. If I were to check his privates, I would check for sores or any skin breakdown. I'd also ask him, how's your avoiding pattern? Do you avoid regularly?
Avoiding?
Do you pee regularly?
Oh,
You
yeah.
urinate?
Yeah.
Yeah.
Oh, wow.
Is there any unusual color or odor? Is
No, I don't think so.
Is it clear? Yeah.
No.
Well,
yellowish.
Any burning?
No.
No. Well, that's good. Okay. So as we go down, okay, I'll be checking femoral pulse, popliteal pulse. I also check for any edema. No edema. Skin color's good. I'm going down. Okay, so dorsal pedis pulse. I think this posterior tibial pulse. I think I'm supposed to check for posterior tibial edema too, I think. Cap refill. Good. I also have you do range of motion with your legs if you could just, yeah, good job. Okay, excellent. And push, pull, good. And you walk normally, and you don't use anything to ambulate with, do you?
Nope.
Oh my goodness. I'm trying to think. Let's think. I think I guess I would lower the bed, wash my hands and document, I think. Thank you for your time.